Hey guys, welcome back to my channel. If you're new here, my name is Rebecca and I am a stay-at-home mom and an online reseller. And this is another video from my car because mom life, and this is the only time I have right now. So I do have the air conditioning on because it's actually quite hot. Even though it is a couple days into October, it's supposed to be 80 degrees. My car is saying it's 76 outside, which is quite warm for us here in Pennsylvania in October. But yeah, I have to have the air on, otherwise I will probably just die of heat stroke. So we're gonna have to deal with that little bit of noise. Hopefully I'm speaking loud enough that won't bother you. I wanted to come in and do a little bit of a pregnancy update because I feel like it's been a little bit since I've done one, and I've had struggles just even getting any videos out lately, which I'm sure if you are already subscribed to my channel, then you know that, but that's just the way life kind of is right now. So as of today, I am 33 weeks pregnant. This is our third baby. If you're just joining me, it's our third baby. We have a boy who just turned 5, a girl who's 2.5, and this is also a baby girl. So she will be our third and last baby. So I'll do like a quick recap of my last couple appointments or what's been going on. So baby is very healthy. They are estimating that she's like 4.5 pounds, but that's on an ultrasound, and I know that's not like super accurate necessarily. I kind of doubt she's that big, but you never know. So she's roughly 4.5 pounds, and at my last check-in last week at 32 weeks, I checked in at 167 pounds. So I started off at 134. So I'm up like 33 pounds, I guess. I'm trying to do math in my head. I'm up roughly 33 pounds, which is still in the normal range. Now I hear them saying 25 to 40 is normal. As I say in all these videos, it doesn't really matter too much to me, but that's where I'm sitting right now. And my blood pressure's been fine, heart rate's been fine, all that stuff's been fine. Like I said, baby's been fine with the Doppler, her heart rate's been fine. Everything's just fine as far as our health considerations go. So the big thing that has not necessarily changed, but I guess kind of changed or updated, is that I recently went for an ultrasound the beginning of last week. I think it was one day before I turned 32 weeks. And it was an ultrasound to see if my placenta had moved out of the way. So my condition at my 20-week anatomy ultrasound was that I had Placenta Previa. Now, there is different kinds of Placenta Previa. So there's like complete Placenta Previa, which means your placenta is completely covering your cervix. There is partial, so it's like partially covering your cervix. And there is marginal, which means it's not covering the cervix, but sitting really super close to the cervix within 2 centimeters. And then there's just like a low-lying placenta, which is still low, but I think higher than 2 centimeters. I'm a little bit shaky on the low-lying versus the marginal. But my understanding from what they had told me previously at my 20-week was that I had marginal Placenta Previa. But at this ultrasound, they were trying to tell me that last time I had at least a partial Placenta Previa, or maybe even a complete Placenta Previa. I don't know, that's not what they told me last time, but that's what they're telling me they told me last time. So I don't really know what happened there. It doesn't particularly matter, I guess, what they told me last time. What matters is what my placenta is doing right now. And right now I have marginal Placenta Previa, which means that is within that 2 centimeter range from the opening of the cervix. And mine is only 0.5 centimeters away from the cervix. So that means I have to have a C-section because it is entirely too close for the baby to be able to get out without hitting it and making both of us probably bleed to death if not intervened. That's basically what would happen. My husband even asked, he's like, what would happen like back in like the 1700s, which, I mean, this would have happened even more recently than that, but he's like, what would have happened then? I'm like, we would have died. The baby would die and I would die because you'd bleed out, because they didn't have ultrasounds and they didn't do C-sections unless they were just saving the baby, but you wouldn't know. So anyway, that's really morbid, but nowadays we can do C-sections because we have ultrasounds and know that. So I am scheduled for a C-section. I've never had a C-section. I'm basically completing the trifecta here. I've had an epidural birth. I've had a completely unmedicated birth, which is what I was hoping to do again this time, but now I'm going to be having a C-section. They are going to do one more scan like the week before my C-section is scheduled, but they said there's really, really unlikely that it's going to move out of the way enough to be able to deliver vaginally. So C-section basically is what it is. And I have mixed feelings about it. I mean, I honestly don't want to have a C-section. I think most people don't. Some people do choose to go that route, but for me, it's definitely not what I wanted. I'm not like scared of it, and I'm not stressed out about the C-section because there's nothing I can do. I can't make my placenta move. It didn't happen because of anything I did or didn't do or anything like that. It's just the way it decided to attach to my uterus. So I can't really change that. So this will be my first C-section, and I am going to be, well, right now my surgeon is supposed to be one of my OBs that's actually 2 weeks behind me in pregnancy. So she will be quite pregnant when performing my C-section, and I do have to have the C-section at 37 weeks. That's what they recommended, or that's what they want to do. I kind of wanted to wait longer because I've never gone early really with my kids. My son was 3 days early and my daughter was 2 days late. So I was like, can we at least go to like 38 weeks? Because I'd rather keep her in there as long as possible, but also I understand them not wanting to risk me going into labor, because if I go into labor and start to dilate, I could experience massive blood loss and it could potentially be fatal to me and the baby. So when you look at it that way, I don't want to risk that at all. And yeah, I don't know. I'm just kind of trying to prepare for all that. I trust the doctors. I trust the medical team. I'm not concerned that they like won't know what they're doing or anything like that. I've never had major surgery. I've only had like wrist surgeries. So I've only been put under general anesthesia once. This one won't be general anesthesia, but just as far as surgeries go, that's kind of my experience. I've had local anesthesia before, regional. This one, they said they will do a spinal block instead of like the epidural. So there's that. Everything's supposed to be able to, like, as long as there's no complications, I'm supposed to be able to do skin to skin with her, and all that, just kind of like a regular delivery would go. So hoping for that. We're still going to use the hospital that's nearest to us. The only downside is they do not have a NICU here, and that did make me a little bit nervous. We could go to a hospital that's a little further away that would have a NICU. I'd have to change providers for that. But they said at this point, there's no reason to think that she should need a NICU, and she's basically at the same amount of risk as a full-term baby would be to need a NICU. So, I mean, obviously they would transfer her if that was necessary, and I would get transferred as well. Probably not with her, which is kind of why I was thinking about maybe going to a different hospital to start with. But I really do like this hospital. This is the same one I delivered at last time. It's smaller, it's more local, and I just really like the staff here. So, and like I said, it's closer to home, so that's nice. So we're still going to try for here. I hope everything goes well. She will technically be full term because she'll be 37 weeks, but she'll be 37 weeks and 1 day. So she's like barely full term. And the reason I said before about kind of doubting that she weighs 4.5 pounds already is because if she's 4.5 pounds and if she gains 0.5 pound a week until delivery, essentially, which is what they usually say for babies in the 3rd trimester, she'd be like an 8.5 pound baby at her due date. And I only had like the mid 7 pound range babies, and she's supposed to be 3 weeks early. So my guess is that she's going to be like maybe 6 pounds, 6.5. So I did get a bunch of preemie clothes, and I get everything secondhand, so I didn't pay a lot for them. I think I paid like $2 or less per sleeper. But I did get a whole set of preemie clothes in case we need them, because I don't like it when my baby's clothes are ill-fitting. It's hard enough to get babies in clothes and they swim around in them, so when they're tiny, it's just a pain. So we're trying to get all that stuff ready. And yeah, my big stressor is just getting everything ready, because they're basically like, okay, so we'll schedule you for 37 weeks. And I'm like, okay, so that means I'm having a baby in 5 weeks instead of 8 weeks, which means I had a lot of stuff I needed to get done and cross off my list. And I'm still working on some of that stuff. I pretty much have the nursery, like all the necessities. I just put my registry together yesterday because I got everything else out of our attic and like made sure like what things I needed replaced, or whatever the case. We're not doing like a baby shower or anything, but I know like my parents were asking, you know, if I had a registry because they wanted to buy us a few things and things like that. And then I also get like the discounts, you know, from Target, and I think Babylist maybe does a discount. That's where I have my other one, but just Amazon stuff over there. So I do like to make registries just so we do get that a little bit of a discount on anything else we need. And I've been buying some diapers. So we have those on hand. I'm not buying preemie diapers. I think we'll just see what happens in the hospital if she fits in preemie or newborn diapers, because diapers are easy to pick up at the store. And yeah, I don't know. I've been a little bit stressed out about it. I have a lot of appointments now. I mean, I guess I've always had a lot of appointments. It just feels like a lot is going on this month in October. So there's like my OB appointments. I have one a week. I have my PT appointments, which are like every other week. My chiropractor appointments, which are once every like 3-ish weeks. I might up my chiropractor appointments a little bit, maybe go once a week until I deliver now, because I have been having some more issues. I just feel big. I mean, I'm 33 weeks pregnant, so I definitely am not small at this point, but I just feel like more uncomfortable. Last night I actually had my first experience of this pregnancy of having hip pain while sleeping, which is not fun. And this is a very active baby, so even in the middle of the night, if I get up to go to the bathroom, she's like, oh, it's time to wake up for the day, and she like, you know, wants to jump around in there. So that's not really fun. It makes it really hard to get back to sleep. But yeah, that's been going on. It's definitely been a different experience trying to prep all of my like postpartum supplies for a C-section versus like a vaginal delivery, because I'm like, okay, I need diapers still because of the bleeding, and I guess that's kind of it. Like for down there care, my understanding is they'll give me an abdominal binder, and I mean, I know the hospital has whatever I need, so I guess if they give me things and I feel like I need more of those, I can get them after we leave the hospital. I don't think it's going to be a big deal. But it is kind of weird to be like, I guess I don't really need to buy like the dermaplast and the tux pads and all that stuff, because I'm not going to be laboring at all. I'm just going to be going in for a C-section. So they do have me scheduled for like the middle of the week, and it's already changed who was going to do my C-section. It was going to be a different provider, and then I don't know, they said she wasn't available all of a sudden. We have 3 OBs in my practice, and I think they take turns. So like I said, the OB who's going to be doing it, who's also pregnant, I think she was kind of like, yeah, I'm not going to be doing any more C-sections at that point in her pregnancy, but I think they kind of got into a tough spot and needed somebody. At least that's the way it kind of sounded, so she decided to do that, which is great. I've met with her several times, and I really like her, so I feel really confident with her, and I'll meet with her again next week, and we'll go a little more in depth through like paperwork and other stuff related to my C-section. We also got our car seat in, which was wonderfully bought for us by my in-laws. They've bought all of our car seats. So that was really nice of them, and we haven't like installed it yet. We're gonna wait probably another 2 weeks. I guess that's kind of the nice part, is that like you don't have to be like have everything ready a month ahead of time, because we know when the baby is coming. It's not going to be a surprise. But I will touch on that. That was kind of the hard part, I think. When I started telling some people about the C-section, there was a lot of like, I know people were they meant well, and they were trying to like make me feel better, because they're like, oh, at least you get to like pick her due date, and at least you'll know when she's coming and stuff like that. And I'm like, you know, even my husband was like, well, at least you don't have to go through labor. And I'm like, but I want to go through labor, and I don't want to pick her birthday, and I don't want to know when she's coming, because that's like what feels normal to me. That feels like something I shouldn't know. Like, I shouldn't know when she's coming into this world. And this is all just my personal opinion, so don't take it offensively if you feel differently. But for me, I'm just like I didn't even really get to pick her birthday, because they were like, well, we do C-sections on this day, this day, this day. And that day is before your 37 weeks, so we can't do that day. So we have these 2 days and 1 day's booked. So I guess this day. And I'm like, okay. I mean, I didn't get to choose. So they basically chose that. I would rather go through labor and pain and all that stuff than have a C-section, which is probably going to be equally, if not more difficult for recovery, just in a different way. And I don't think there's that many people who are like, yeah, I really do want to go get my like abdomen sliced into. Like, and that's not really what I want. So none of those things made me feel better, I guess, is my point. I know people were trying to make me feel better. But like I said, I don't really feel, I mean, I'm a little disappointed, I guess, in that I can't have the delivery that I was hoping for. But I'm not like overly sad about it. Like I said, just because I can't do anything about it. I know that there's no choice here if I want to keep me and baby as healthy as possible. So they did actually show me on the ultrasound too. Like, they did an internal ultrasound, and they were like, so here's your placenta and here's the baby's head, because she is head down and she's like in the birthing position. And her head is like, there's no way that head would get through my cervix without hitting that placenta. It's just so close. So, I mean, it's just nice to be able to visually see that and be like, yeah, there's no way that would be safe for me to try to deliver her with it being that close. So I don't feel sad about that. I am, I guess, just a little bit disappointed about the lack of opportunity to have the kind of birth I had last time, which I really enjoyed. As an unmedicated birth, things went well. And you can check out my last birth story. I've done videos on both my kids' birth stories. So if you want to see that, you can go ahead and check that out. But anyway, I was saying, so as far as like getting things ready for baby, like, we have the car seat, but we're not putting it in yet, because why? We don't need to. I'll probably pack my hospital bag like a week before, just so I know I have everything I want. And then if I need anything, I have a week to get it. But it is less, like, I'm more stressed because I know the due date for some reason. I don't know how that makes sense in my head, but it does. I think it's kind of stressful to be like, here's when I have to have everything in my life ready for a new baby to come home. So along with all the other appointments that I've been having, I also just, I'm actually sitting in the hospital parking lot right now, because I just had an appointment with the lactation consultants here, just to talk about like nursing and I mean everything related to that, because I haven't had successful journeys with that in the past, and I really want to be able to do it again this time, or actually be successful this time. So I did have like a prenatal meeting, I guess, with them, and that went well. So hopefully that all goes well. And also we're hopefully going to have a postpartum doula for a little bit. Once we get home, that's a new program that my husband's work has just rolled out, that they'll reimburse us a certain amount for a postpartum doula. I've never used any kind of doula because we didn't want to spend that kind of money. But postpartum, I think, would be really nice, especially with me having a C-section, and I'm going to need help getting around and lifting things. And hopefully they'll be able to help with the breastfeeding as well. So I should be meeting with them later this week and seeing if there's someone available, because unfortunately they just told us about this program, like they just rolled it out, and I'm like, yeah, I am gonna have a baby in a month. And I know people can get booked out pretty far for those sorts of things, so hopefully it goes well. Hopefully we can get somebody to come and help, because my husband's still gonna have the other two kids to take care of, and I just think a doula would be a better support system for me than my husband in that situation. So hopefully that goes well, and we can get that set up. I feel like that's most of what I have to say as far as like an update right now. I'm probably going to do one more update before we go to actually have the baby. And I hope to also do a couple other videos. I have so many videos I want to do. I just don't know what I'm going to have time to get to. Life has just been super busy lately. But if you have had placenta previa or C-sections or used a doula, postpartum doula, or any of those things, please let me know in the comments, like your experience with them. I would love to hear your suggestions, especially like items that you use for postpartum recovery of a C-section. I have been watching YouTube videos and reading lists and stuff, but it's always good to get personal experiences from people. So I would definitely like to hear how that went for you, and hopefully you have some good tips for me and anyone else reading the comments. I can't do a proper belly shot because I'm in my car, but I will try to show you my 33-week bump. So this is a really awkward sitting bump picture, but there she is. There's the bump, quite big. Definitely feeling like restricted in movements more, and things are definitely getting harder, but still doing good. Haven't had any crazy issues. SPD is still there. But yeah, otherwise we're healthy and we're just cooking until we get to C-section date. So please don't forget to subscribe if you want to come back, and like this video if you enjoyed it. I hope you did. I hope you can commiserate a little bit, or I don't know, if you just enjoy watching pregnant women content, then hopefully this was enjoyable. And I will be doing a nursery tour hopefully in the near future, and I'll show you more of the stuff that I'm going to have set up for postpartum. So thank you guys for watching, and I will see you in the next one.